Good afternoon, everyone. I call this meeting to order.
The House of Commons Standing Committee on Health. Today's meeting is taking place in a hybrid format pursuant to standing orders. J'aimerais rappeler aux
I would
participants
like to remind participants of the following points.
For those of you who are witnesses, raise your hand, and I will the chair, recognize you before speaking. For those participating by video conference, like Sonia here, please make sure that you turn on the little globe at the bottom of your screen, so you turn on your interpretation, and you raise your hand in the hand section if you want to speak. For members in the room, as I said, you can use your raise hand function, and the clerk and I will try very hard to make sure we give first hands up the first place, but that may not be possible. So now I just also wanted to give you a little bit of housekeeping here, and that is that before proceeding with the witnesses, I want to let you know that any proposals or amendments that you wish to submit as part of the study of Bill C-15 must be forwarded to the committee clerk. The clerk will compile them and transmit them to the Standing Committee on Finance no later than February the 27th. So members have until February the 26th to submit their amendments. Just please remember that. Now, subject matter of clauses 400 to 456 of Bill C-16 are the ones to implement certain provisions of the budget tabled in Parliament on November the 4th. Now, pursuant to the order of reference for the House and the motion adopted by the Standing Committee on Finances on Wednesday, December the 10th, 2025, the committee will commence the study of the subject matter of clauses 400 to 456, Division 25 of Bill C-15, an act to implement certain provisions of the budget tabled. Now, today we have the Minister of Health here for the first hour. The Minister is the sole witness. Minister, welcome. And I just wanted to welcome you to the committee and to say that you have 5 minutes to make your opening statement, and then we have the questions and answers. You know the drill. And so, please begin, Minister, for 5 minutes.
Merci, Madame la Présidente. Mesdames, Messieurs les députés, merci de m'avoir...
Thank you, Madam Chair. Thank you to members of the committee for inviting me here today. And thank you for the important work you do as a committee. Today, I will speak to the role of the health portfolio in supporting the Budget Implementation Act.
Of a strong, universal public health care system makes every one of us stronger and more resilient, both as individuals and as a country. Avant d'aller plus loin, j'aimerais...
Before going any further, I would like to point out that yesterday we introduced a bill to establish a more connected healthcare system in Canada. Fast and secure access to personal health information is essential to saving lives and improving care for Canadians. This legislation is part of our government's plan to strengthen and protect the healthcare system and give Canadians more control over their health. This is great news for Canadians, for patients, for doctors, and I look forward to working with this committee to move forward with the implementation of this legislation. The future we want starts with building the communities we want. That's why some of the most significant investments in Budget 2025 are in local infrastructure, including a new fund to build strong communities, a $50 billion fund with $5 billion for health infrastructure. In many communities, hospitals built in the 1970s now serve twice as many people as they were designed for. This investment will help provinces and territories build more health facilities, renovate hospitals, emergency rooms, urgent care centers, and medical schools. Also, with Budget 2025, we're investing in health research and supporting world-class Canadian talent to build both a stronger economy and a better healthcare system. A resilient Canadian economy must advance research and attract and retain the best talent in this field to stimulate our growth. In addition, we will conduct a comprehensive assessment of infrastructure and healthcare needs in the North to improve access to healthcare in northern communities.
Resilience also depends on having reliable access to life-saving vaccines and medication, because vaccines save lives. This is especially important in the event of a health emergency. Biomanufacturing is the key, and that is why we are creating the conditions that will allow this industry to thrive. Si la production des vaccins est
Vaccine production is not only a health imperative, but also an economic imperative. In addition to contributing to the health and safety of Canadians, a robust biomanufacturing industry in Canada stimulates our economy, will create well-paying jobs, and drive innovation.
This important sector grow with investments through the biomanufacturing and life science strategy. As a result, more Canadian scientists are at work in more labs across the country doing research that will make life better and safer for Canadians. Because better health care...
1 minute.
Because better health care begins with better research. Because in Canada, we believe in science and we value our scientists. With this growth and an evolving threat landscape, new biosafety and biosecurity considerations have emerged. We now need to strengthen oversight to address these concerns. Dans cette optique, la loi d'exécution du
With this in mind, the Budget Implementation Act proposes several amendments to the Human Pathogens and Toxins Act, allowing us to respond more quickly to biosafety and biosecurity risks in the biomanufacturing sector.
As Canadian biomanufacturing continues to evolve, the way we oversee and regulate the industry must evolve with it. Je serais maintenant ravie de prendre...
I will now be happy to answer your questions.
You know, you can elaborate on what you want to say during the question and answer period. But before I move to that, I would like to introduce your officials who are here to give you support if you need it. And so I'd like to introduce Shailene Curtis-Mikalev, Deputy Minister, Jocelyn Voisin, Senior Deputy Assistant Minister, Health Policy Branch, Pamela Ongthin, Assistant Deputy Minister, Health Products and Food Branch, Matt Jones, Assistant Deputy Minister, Healthy Environments and Consumer Safety Branch, Kendall Weber, Assistant Deputy Minister, Controlled Substances and Cannabis Branch, Ryan Higgs, Acting Assistant Deputy Minister and Chief Financial Officer. And from the Canadian Food Inspection Agency, we have Robert Ianiro, Vice President of Policy and Programming. The Canada Institutes of Health Research, we have Dr. Paul Hibert. And from the Public Health Agency of Canada, we have Nancy Hamzawi, President, Kimby Barton, Director General for Biosecurity, Regional Operations and Emergency Management Branch. And in the second hour, I will introduce Dr. Natasha Crawford later on. But right now, Minister, we're ready for the question and answer. The first round of questions is going to be a 6-minute round, and 6 minutes is for the question and the answer. And I will give you a little shout out when you have a minute left or when you have 30 seconds left so that you can get everything you want in as soon as you possibly can. So I now begin with, for the Conservatives, Mr. Major, Dan Major. 5 minutes, Dan.
6. Thank you, Chair.
Oh, sorry, 6 minutes.
Thank you, Minister, for attending today, and officials.
Call me on that.
Minister, in May, the Ottawa Police Chief sent a letter to your government raising childcare safety concerns about the federally approved ejection site on Nelson Street in Ottawa. Has your department briefed you on this letter? Yes or no?
Yes.
Have you read the letter?
Yes.
This letter stated, and I quote, "The Ottawa Police Service is especially troubled by the unintended but serious consequences, such as the closure of nearby childcare facilities due to safety concerns, a situation that is without precedent in our city," end quote. Were you aware that a childcare facility was closed next to this injection site because of safety concerns? Yes or no?
You know, I am working very closely with the province on that specific matter, and we are, on s'ajuste à toutes les.
We adapt to all of the regulations put in place by the provinces. So when it's about renewing a site, if the province wants to renew a site, we always work with the provinces.
You obviously read the letter. In that letter, it said, the police chief said, we're concerned about a closure of a site. So to answer the question, were you aware that the site, the child care site, was closed? Yes or no?
If I was aware that
were you aware? You said you read the letter, so you were obviously aware that the child care site was closed. Correct?
Yeah.
Yeah. So, Minister, the law enforcement asked your government to move the injection site to protect children. But on November 28th, 2025, you renewed that permit for this injection site. Why did you ignore law enforcement?
Thank you for the question. The process for which the Government of Canada looks at and Health Canada looks at safe injection sites is a multifactorial process. And so that would have been a part of the considerations.
Sorry, and I might, this question was for the minister, and I'm aware of the process. The minister signs off on this. No. Health Canada approved these sites. Minister is the head of the department. At the end of the day, the buck stops with the minister. So I just don't understand why you approved a site after the community was asking for it. The chief of police was asking for to reconsider the renewal and moving the site, and you say no. Why would you reapprove the site when everybody was screaming at you, asking for you to move the site?
She had referred to her official because her official understands the process by which sites are chosen. The minister does, but the nitty-gritty of a lot of these details can be answered by the official.
Can the minister
unless the minister wants to do it herself, but she referred to her official.
That's all right.
Okay.
I have another.
No. You want the answer? OK.
Why?
Alors, ce que je vais vous expliquer, c'est que quand
What I will explain is that we received the letter. I saw the letter from the chief of police.
Law
vous voulez une
enforcement.
réponse ou
Do
vous
you
la
want
voulez?
an answer or do you not want an answer? If you want an answer, let me answer.
Letter.
Répondre. Je vous réponds que oui, j'ai vu la lettre du chef.
Yes, I saw the letter from the chief of police. But the letter from the chief of police is not the only factor that comes into play in approvals. As you know, he shared his fears about the site, and Health Canada went on site to work with the site to put in place more stringent measures. And I must say, because the site was open, we don't fund the sites. You have to remember, we provide exemptions. The provinces fund the sites. If the province wants to fund a site, we are there to conduct consultations.
Have you personally visited a federally approved supervised consumption site as health minister?
Oui. Je reviens.
Yes, I've just returned from Vancouver, and I was in the east side with police. I spent 4 hours there, and I know exactly the scope of the issue.
From what you saw, would you want one of these sites next to children?
Vous savez, je dis tout le temps ça.
You know,
Et
I
je-
always say, I said it in 2025, and I'll say the same thing in 2026. The drug crisis is serious, but it's multifactorial. It's not a one-size-fits-all.
Minister, does Health Canada set an age requirement on who can access all federally approved supervised drug consumption sites? Yes or no? Health Canada.
Non. Je ne pense pas, je ne sais pas.
We provide the exemptions. The operators determine the process under which they provide services.
So that's a no? Correct? That's okay. I take that as a no. So, Minister, if a 16-year-old enters a federally approved drug consumption site, is there any requirement from Health Canada that prohibits that minor from injecting fentanyl at that site? Yes or no?
Mais nous venons de vous dire que nous n'opérons
We
pas.
just said we don't operate the consumption sites. It's really managed by the provinces. So that is not under our responsibility.
Pas sur le terrain.
We are not on the ground, is what I'm saying.
Sorry, that question has gone over. You're now 30 seconds over, Mr. Major. Sorry, I allowed you some leeway. Okay, and now I go to the Liberals. And sorry, I don't know who's first. And we now have Ms. Jacek. It's for 6 minutes, please, Ms. Jacek.
Thank you so much, Madam Chair. Thank you, Minister, for coming to speak with us today. I would like to hear a little bit more about the Canadian Dental Care Plan and how it's rolling out across the country. It was a piece of legislation in the last Parliament that I was particularly happy to support because, of course, we know that this does provide dental coverage for the first time, or for the first time in a very long time, for many Canadians. And it's a significant change for families who've been postponing or avoiding care because of the associated costs. Could you provide an update on access to dental care, including how many Canadians are currently covered and how implementation and uptake are progressing across the various provinces and territories?
Je remercie le membre pour sa question.
I thank the member for the question. I had an update on dental care today. We have over 5 million Canadians who have signed up for the dental care program, 2.8 million who have already received care, $27,000 dental health professionals have provided services to Canadians, and 95% of dental care providers are billing to the dental care plan. This means patients have access to a broad range of providers across the country. So the results are extraordinary. We need to continue pushing the program forward because based on projections, there could be about 10 million people who could be covered under the dental care plan. So there are still Canadians who are not yet aware of the program. So we need to continue promoting it. And something else I'd like to take the opportunity to say, the dental care plan has to be renewed every year. So at the end of March, on April 1st, people will need to renew their card to have access to dental care. So I think I've answered your question.
Actually, just a little bit of further information. So the majority of the provinces in essence and territories are enthusiastic about this program as well. It's sort of something that you've discussed, I have no doubt, with provincial ministers of health, and they have received this very well.
En fait, je pense que, écoutez, le
In
programme.
fact, the program is good news for Canadians. It's something the federal government has added as a service to people. Dental healthcare is healthcare. We help the provinces, and the provinces see that the program is very beneficial for their residents.
ils apprécient le programme aussi.
They appreciate the program as well.
So another program that our government has introduced addresses food security, and of course, absolutely vital that people have good nutrition to have good health. So we've announced a number of measures to improve food affordability, including a boost to the GST rebate, significant capital investments to support food businesses, and targeted funding for food banks. So how do you see these initiatives strengthening food security? What do you feel is going to be, in essence, the health outcome for Canadians? Do you see this as an important piece that is part of your responsibility?
Dans cette période d'incertitude économique,
During this time of economic uncertainty, all of the support the government can provide to people will be welcome. Now, it's true, we are providing the GST benefit for people who are vulnerable, but people also have to have access to healthy food to feed themselves. And I made an ECHO announcement last week. It was on the north shore of Montreal, in Thérèse de Blainville, and I visited a grocery store that really had affordable, healthy food for people, for nearby residents. And there I met a mother I didn't know who told me that she appreciated the announcement because she had 2 jobs, and now she felt she'd have a little bit more ability to buy better products for her 2 children. So yes, I think this will provide support to families, and it's for groceries. It's to encourage them to eat better.
You think you're fine? Okay, thank you. Then I'm going to go to the Bloc québécois. Monsieur Blanchette-Jonca. 6 minutes, please.
Merci, Madame la Présidente.
Thank you, Madam Chair. Welcome to today's witnesses. Minister, I'm curious. How many hospitals are there in Canada? Honestly, I don't know. I don't know. You're Minister of Health. Yes, but I don't manage hospitals. Does somebody have that information? No? Do you have the number? No? Okay. It'd be good for you to reassure us. Listen, it's a very interesting question, yes, but I don't have the answer. Okay. You said in your introduction that your government was proud to announce $5 billion for new healthcare infrastructure over 3 years. How much is that in new infrastructure in health? $5 billion over 3 years. It depends on what provinces choose to do. This is a joint program with provinces, so it's $10 billion because the provinces are contributing $5 billion, and so is the federal government. So it'll depend on what provinces decide to put forward as projects. In certain cases, it's construction. Other times, it's additions. Sometimes it's repairs. It will depend on the province's priorities. Minister, here's a project you know well. You're from Papineau, the Maisonneuve-Rosemont Hospital. How much do you think that cost, its construction? It wasn't in this program. $3.6 billion for one hospital, and you are providing $5 billion over 3 years. Do you think that's enough for all of Canada? Listen, is it enough? Over 3 years, it's a very good start. At least the government is taking note of the province's requests. The provinces surely talked with the Prime Minister, and we are assisting them in building infrastructure. So, Minister, rebuilding Maisonneuve-Rosemont Hospital, it's cost nearly $5 billion with inflation. But what your government said regarding its budget, because it is essential to strengthen infrastructure in the area of healthcare throughout the country. The budget from your government in Chapter 1, Are We Building Canada Strong? That's the title of your budget. when you're only investing $5 billion and one hospital, the project I just named, the Maisonneuve-Rosemont Hospital, is at $3.6 billion, which is $5 billion with inflation. Your government says it's essential. You know, the investments we're making, we are working jointly with Quebec, with all provinces and territories, and this is additional money on top of healthcare transfers. This is additional money in budget 2025. We can talk about healthcare transfers, 3% until 2028. After that, what will it be? The cost of healthcare in Quebec will cost more than what we receive from the federal government. Do you recognize that there's an imbalance between the amount that the federal government sends to Quebec and the actual cost to administer healthcare systems? I will meet the government of Quebec. I'll meet my counterpart from Quebec next week. And I would say that Quebec also signed the agreements on healthcare transfers. So you recognize that it's more expensive. We'll always work with Quebec. Minister, you recognize that there's an imbalance. There are people who are paying the cost. In my area, I have the Trois Pistoles emergency room that's struggling. Montjoly as well. They've already cut staff and cut services and opening hours. The federal government is not acting in... Well, Minister, the agreement between Canada and Quebec and the provinces, it was 50% initially. Currently, you're paying 22%. Do you understand that that imbalance, that shortfall, has consequences on services offered in the areas of Quebec, in the regions of Quebec? As I've said, I work closely with my colleagues in the provinces and territories. We are all there to see how we can do better for the health of Canadians. You say your government believes in science. You know, I sit on the Science and Research Committee, and the commissioner spoke to us recently, and I asked a question about your bill on national interest projects, and she said that the list of projects, well, she wasn't consulted on it. So the government believes in science, so why don't you consult your own chief science officer before saying it's a national interest project? Can you explain that to me?
Je vais pas opiner sur quelque chose que je ne sais pas de quoi vous parlez.
I don't have... It's just important when we read speeches and when we speak to committees. You know what she said to us, Minister? It's a nightmare that your government created a bill to circumvent all of the laws to pass your national interest projects aside from the criminal code for 3 years. So as health minister, are you concerned by this authoritarian measure and the impact it could have on people's health when evidence and scientific analysis from your government are not even consulted, they're ignored? Well, I don't even understand what you're saying because honestly, all of the decisions we take are based on science. So I don't understand these allegations. I would invite you to look at the meeting from November 26th at the Science and Research Council Committee. Okay, I will have a look. 15 seconds. You don't have an opinion? Does it bother you that the government is not consulting the chief science officer and you're saying your government believes in science? Thank you.
Time is
I will
over.
have a...
Gone over.
I would accept a written answer. A written answer, please, Madam Chair, because it's difficult to have a verbal answer. I would request a written answer from the minister because I don't have a verbal answer. Thank you.
The minister is aware, and we will send that answer to the clerk and pass it on to everybody. Now I go to the second round. It's a 5-minute round. Mr. Bailey, for 5 minutes for the Conservatives, please.
Thank you, Chair. Minister, on October 13th, the Immigration Department made a social media post to promote Canadians' public health care system to people interested in coming to Canada. And I realize this post came from IRCC, but the reason I bring it up again is because the committee received a written response from the Immigration Department confirming that the post was not shared with their minister for approval. My question to you, as the Minister of Health, were you aware that the Immigration Department would be advertising to foreigners, inviting them to come to Canada to use our public health system? Are you aware of this post? No? If you weren't aware, should the health department not be informed of other departments in the government intruding on your jurisdiction and taking the liberty of advertising our healthcare system without the health department's knowledge? Where are departments not in communication with each other? Was anyone aware?
Thank you for the question. I don't have specific information with respect to what information the Department of Health was aware. We can take it back and see. I don't know to what consultations were made.
So obviously nobody's been disciplined for this, for putting this non-Canadian healthcare before Canadians, literally advertising this to non-Canadian citizens. At a time when 6.5 million Canadians are without family doctors, wait times for healthcare are skyrocketing. Do you think it is appropriate that the Immigration Department is advertising to foreigners that the Canadian public healthcare is open to them?
I haven't seen the advertisement, so I can't comment on an advertisement I haven't seen. But we will definitely look at the advertisement that you're referring to and
Well, the
get back
question's
to
for the
you.
minister, but will you commit today that your government will no longer advertise our healthcare system to the rest of the world while Canadians are struggling with healthcare access? Minister?
We didn't advertise, and I will not start advertising anyway. So, moi, en tout cas, nous n'avons pas fait de publicité.
We haven't done any advertising. It's not from health. It's not from me. It's not from health. So I can say, no, I don't intend to do any advertising.
Healthcare for asylum seekers. And this type of advertising just balloons that problem. And we as Canadians are receiving worse health care than people that aren't even from this country. Are you aware of that? Are you aware of the $900 million that was spent on asylum seekers?
Oui, effectivement, je sais que immigration.
Yes, I know that immigration receives money for asylum seekers. That I know. But it's not a file that I manage in my department.
Something that really needs to be looked at. And again,
Point of order. Point of order. Are we allowed props in the committee? Because I believe the member just pull out a prop just now.
That's
a piece of
Always allowed.
paper.
Just double checking. Just double checking.
I'd like to ask you a brief question on sealed vaccine reports, the access to information. A written request from a Conservative colleague revealed that an access to information request on vaccines and adverse drug reactions since 1998 has been pushed back for 15 years. Are you aware of this?
Oui, ben, je l'ai lu, évidemment. Je connais mes
Yes,
enjeux.
I read it. I know my files. I see them in the morning. Yes, I was informed recently when there was the access to information request. What I can say is that, of course, requests are very complex. They're huge, but the department is working closely to resolve the issue as quickly as possible.
For documents fulfilled faster, should we be asking for these documents at committee? Because we can do that if it would speed things up.
So I'm happy to provide additional clarity on that. So this request came in early in the pandemic, so we're a few years in. We are not intending to take, the portfolio is not planning on taking 15 years to respond to this request. We anticipate that the response will come within, during this calendar year, and we have been in close discussions with the requester to be able to scope it so that we can move through the millions of pages of documents to make sure that we, make sure that we respond to our obligations under the Access to Information Act, and in as timely a way possible, provide that information to Canadians.
Thank you very much. Time is up, Mr. Bailey. I now go to Ms. Chi for the Liberals. 5 minutes, please, Ms. Chi.
Thank you, Chair. Thank you, Minister, and for all the officials for appearing today. Minister, for years, Canadians have carried their health information from appointment to appointment, repeating their medical history, managing paper records, and hoping systems would talk to each other. It was exciting to see that the Connected Care for Canadians bill was introduced in the Senate yesterday. Could you let the committee know how does this bill change the day-to-day experience for patients and their families?
Je pense que la bonne nouvelle pour les
I
patients,
think the good news for patients with connected care is that, I'll give you an example. I always talk about when I went to Val d'Or, there was a demonstration of non-political care because the doctor who sees a patient in a city, the patient had to go to another city to receive care, but the health file had to be printed, given to the patient in person. The patient had to bring it to another doctor in another city. The pharmacist on the ground floor couldn't send the prescription upstairs, just one floor above, because the systems aren't connected. So what we've seen with patients who've talked to us, I also talked about different stakeholders as well. What we realize is that having connected care will really save lives because it will prevent people from falling through the cracks because their results haven't arrived in time where they need to be. So I think this will really advance healthcare services in Canada. And I have to say, I talked with my provincial and territorial counterparts. We talked about this in October at our meeting. And they were very supportive overall of moving forward with this legislation.
My next question is to the officials. So we know the Pan-Canadian Interoperability Roadmap is underway, but this bill goes further and faster. Could one of you help explain how this piece of legislation accelerates the connected care across provinces and territories?
The minister is a witness here, Ms. Chi, so perhaps you can ask the minister and she can refer to the appropriate official.
Yeah, absolutely. So the question is directed to the minister then.
Thank you, Chair, for the question. So the bill really enables that technology exchange between systems. So the interoperability roadmap is setting those standards voluntarily with vendors and with provinces and territories across the country. But the bill really actually mandates that use and also prevents data blocking, which is a practice that we see by vendors, but also could be health authorities or others who are unintentionally blocking data. So it accelerates the adherence to those standards, which are already international.
To that, how do you see this sparking innovation and technology in the field as well?
Yeah, so by doing that, it really unlocks the potential of data that's currently locked in these electronic medical records across the healthcare system and in hospitals that is really not being connected to across healthcare settings or for innovators who want to use synthetic data or anonymized data for innovations and the use of AI in the healthcare system, which has enormous potential really to transform how healthcare is delivered and really provide better outcomes for patients.
Yeah, thank you. And just to your point, right, this bill definitely established that new foundation to support digital tools in health and responsible AI in healthcare. And I think you answered it partly as well. Why was it important to pair data sharing with innovation? And what kinds of breakthrough could Canadians see as a result?
51 seconds left.
One of the key objectives is really making sure that patients get access to their own health data. So just the way that you have access to your bank account and you can do your banking online, that a patient would have access to their comprehensive patient record so that they don't need to repeat their story every time they go to a different specialist. So that's one of the key objectives, but also a more efficient health system, and then, of course, also enabling innovation.
Thank you so much. And Minister, one concern Canadians often raise is that where you live determines the type of care you receive. And how does this bill helps remote areas, rural areas to feel connected compared to urban
Minister
centers?
has 8 seconds to answer.
Sorry.
Yes or no?
Can I answer?
Yes, 8 seconds.
In 8 seconds? Oh my God. Okay.
So it's now
just
gone
one thing I
overtime.
was, it will help as, so we need first to make sure that all remote communities have a good access to internet. And then it will be a game changer for them because, what I saw on the ground, all those AI tools that remote community are starting to use, it's changing I think the technology will, in maybe 2-3 years, we will have a very different health system because things are moving very fast in the right direction.
Thank you, Minister.
Thank you. I would ask members, if I give you a time limit, please not go ahead and ask a question that requires a long answer. It could come in another round, please. Okay, otherwise we're never going to have the time for everyone to ask the minister questions. Now, Mr. Blanchette-Jonca.
Merci, Madame la Présidente. Simplement vous informer
Thank
que
you,
moi,
Madam Chair. I just want to inform you that I have my timer, so you don't need to let me how many seconds I have left. Yes.
You do not exceed that, Mr. Jonca.
Oui. Alors, Madame...
Yes.
On the second
No,
round.
actually, this is a 5-minute round. But we usually gave the block, when we're doing a two-hour session,
Okay.
a second 6
Thank you.
minutes.
Thank you for clarification.
Madame la Présidente...
Madam Chair, my request for you is to not interrupt to tell me how many seconds I have left because it can disrupt our exchange with witnesses.
Will not let you go over time, though. Just remember that. I will just have to cut you off if you continue to speak.
Est-ce que vous comprenez bien la traduction,
Do you
Madame?
understand the interpretation well, Madam Chair? Because that's not what I was saying.
To give you a time limit. But most people get it and they can still speak and listen. I'm supposed to keep the time, Mr. Jonca. You have 6 minutes. It hasn't started yet, but when you have your 6 minutes, if you exceed it, I will tell you so. Thank you. Go ahead.
Madame la Ministre, pourquoi le gouvernement...
Minister, why is the government refusing to honor the authorizations set out by Sun Life in the Canada Dental Care Program? Patients are having to pay amounts they don't expect after a rule was changed without notice.
Vous êtes pas au courant de ça?
You're not aware of that? A change without notice? No, I'll turn to the department. The health department, you cover dental care? Yes. So Sun Life, which a private company you hired to manage the Canadian Dental Care Program, on October 17th, they changed the lab reimbursement fees without notice, and currently patients have to pay higher fees. Are you aware of this?
Yeah.
I know sometimes there are patients who raise irritants in the dental care system, but I'm not really aware of changes that require patients to pay more from lab fees. And I have to tell you, I'm on the ground a lot. I visit a lot of dental clinics, and that hasn't been raised once with me. Well, I invite you to speak to the Quebec Dentist Association. I spoke to their association, or with your writing office, because I've received dozens of letters like that in the last week. Perhaps you could send them to us. I invite you to contact my office with great pleasure. Is Health Canada aware that there are 200,000 people who have received authorization to be eligible for the dental care program, and then finally they received a letter to state that they've been refused from the system?
Je m'excuse, la question c'est...
Excuse me. The question is that people were refused, they're not eligible? Yes, 200,000 people. I'm not aware of the circumstances for those people, but if they don't meet the criteria, they won't be admitted. But we could discuss if there's a number. I'm not sure about the number. Listen, you know that to be eligible for the dental care program, it's based on income. So there are people, probably, who weren't eligible, who were refused. I'll explain the situation to you. People were pre-approved by the dental care program, they started receiving treatment, and finally, Health Canada sent them letters of refusal saying, "We made a mistake. We thought you were eligible, but finally you're being refused." Do you understand that situation? Okay. Yes. So I'm asking the question, why is the government acting like that? Nearly 200,000 people received these refusal letters.
Écoutez, parce que si les gens ne...
Listen, because even if those people had received care, the minute that the government becomes aware that they shouldn't have access to those free services, we have to take them away. So you think it's logical that somebody goes to get dental care and then the government admits their error and says, let's say this person had teeth removed, they'll say, okay, it's fine, you don't need to have your teeth back, you can keep living like that. Is that logical according to you? Listen, dental care, it's very simple. You know, it's based on income. So the person probably was over the income bracket to have access to dental care. Minister, I'm talking about people who are pre-approved by your system, and finally they were refused. This has an impact on their current quality of life because they're not able to afford the care and continue their treatment. You don't understand that? No? People who were approved and then not approved. There are changes in programs. I wonder if you're trying not to understand. You don't understand? So you're talking about people who were pre-approved, who didn't have service. They began to receive treatment, and then they were refused. And others who hadn't yet received service. There are 200,000 people. Does this not ring a bell for you? Am I informing you of this? No. I know there are people who were pre-approved, and then they were told they weren't entitled to the system, but it was based on their income. So now you're talking about people whose teeth were removed. I gave you an example because you like to provide examples when you talk about your visits on the ground. I think it's important. Once again, I would say I've done a lot of visits on the ground. People didn't talk about this. Health Canada doesn't know how many people were pre-approved and then refused. Do you know or not? I don't have the statistics before me. Could you respond in writing? We could respond in writing because you are boasting about your system, but you don't know about the failures. I don't expect it to be perfect, but currently you don't seem to know what we're talking about. And I'm telling you, I know exactly what you're talking about, but I'm telling you that I'm not sure about the 200,000. I don't know about the number, but I know there were cases. What you need to understand is that this is a program, well, that is related. Let me answer. We provide the dental care program through dentists. Approval is based on the person's income. Yes, Health Canada. Isn't it Health Canada that manages the program?
Thank you, Chair. I have some questions for the minister. I'm following up on my colleague's questions, Mr. Mazur's questions on about drug consumption sites. I know that Canadians are concerned about your department approving supervised drug consumption sites across the country. Your department approved a consumption site in Kelowna, up the highway from my riding. That's only 60 meters from a daycare, from children. So would you listen to parents and agree with me that no supervised drug consumption sites should be opened that is close to a daycare or school? Children, young children.
Comme je l'ai déjà dit à votre collègue,
as I told your colleague, we follow the norms that the provinces and municipalities put in place. So we work with the provinces on that. Now, when the request comes into Health Canada...
Colleague, thank you on that, but I guess I'm asking you, do you believe it's safe for children to be near a drug consumption site? You have the power. Is it safe? You have the power to do something about it. as the minister. Okay, that's funny, but not really, because there are children near
Non.
drugs.
Ce que je vous ai expliqué déjà, c'est
What I've
que
already explained. Listen. Supervised consumption sites are one of the ways to manage the drug crisis. One of the ways, whether we agree or not. Now, we conduct consultations, and for those sites to be open, you need to know there are consultations that were done with communities. There's a whole series of consultations. Now, if there are problems,
It is safe for children to be around drugs.
maybe when it was open,
Oh, okay. So
personne n'avait de problème. Mais maintenant,
maybe nobody had a problem. But now, people have other issues around this. But when those sites were opened, based on the province's request, and Health Canada conducted consultations, because there are consultations, there was no problem for Health Canada to provide the approval. But now,
near a daycare. My question, I guess I'm asking about safety because you mentioned Minister, you mentioned that you visited for 4 hours Vancouver drug consumption site. I guess my question to you is, did you have a police escort?
yes. Oh, no, I was with the police.
You were with the police.
Yeah.
Now, why
They were
would you need
showing
to
me.
be near why would you have to be near with police if it's safe? I mean, do we want children near drug consumption sites? If you need to be with police as an adult, why did you need a police escort?
Non, je pense que j'avais été avec la police. C'est pas
no,
parce que
I was with police not because I needed to be escorted. I think it's because the police works. The SAR was there too. So I went, I visited the police. The police is on the ground.
If it's a safe place to be, are you saying police are at all drug consumption sites?
que dans la partie est de Vancouver,
In
il y a
the Vancouver East Side, there are people all over the street as well. We're not just talking about the consumption sites.
On the street around the drug consumption site. So that's why police needed to be there, and that's why you needed an escort. Okay, thank you. Another quick question.
1 minute.
Just about crack pipes. My colleague, Mr. Mazur, asked your official, Ms. Weber, on December 9th if Health Canada funds are used to purchase crack pipes. And she told us yes, that the organizations are funded to purchase pipes. But when he asked you in the House on December 11th, you said that the government does not fund crack pipes. So just who's telling the truth here, Minister? Is the government funding crack pipes? Because we've got two different
30
answers.
seconds.
And it's very important because crack pipes are littering the streets of my community and others around drug consumption sites in particular,
15
and
seconds.
elsewhere. I asked the minister for the answer too, because you both answered, Ms. Weber and you answered differently. So I just want to know, what, as the minister, what's your answer?
3 seconds.
We provided a written answer to this committee, which reflects the funding agreements that we have.
Even though there's
with-
two different answers, we have
Well-
one from the minister and.
You off because you're now 10 seconds over. I cannot continue to have people go over time. I'm trying to run a meeting to end at a certain time. Guys, you've got to work with me here. All right? I'm giving you a warning. You seem to think that as long as you want to answer questions, ask questions, you can continue
I was
anyway,
10
regardless.
seconds over.
I know. I gave you. You're now 32 seconds over. But I'm not counting my intervention, but you were 10 seconds over. But the minister still hadn't answered. So remember, when you're going to ask a question, don't spend a lot of time using up the time so the person cannot answer it. That's all I'm trying to get people to understand. You know, and I'm just really having to keep the time here, guys. I'm sorry. Ms. Sidhu for the Liberals, 5 minutes, please.
Thank you, Madam Chair. Thank you, Minister and official, for joining us. My question is to the Minister about 988 Suicide Crisis Helpline. Minister, how does sustained funding for 988 to strengthen Canada's mental health system and ensure support remains accessible to Canadian when they need it, in moments of when they really need help.
Merci pour la question. Écoutez, de toute
Thank
façon,
you for
le
the
financement
question.
de la ligne
The
9
funding of the 988 line was really good news in the sense that we can continue supporting Canadians who are in distress. As you know, the 988 line has answered over 700,000 calls since its creation, which is huge. People and young people are asking for help, and the federal government is there to allow that line to continue operating, and we will always be there to support Canadians when they need it.
Next question is Minister, Budget 2025 is focused on modernizing Canada's health system and strengthening patient safety. And you said that data saves life. How does Bill S5, the Connected Care for Canadians Act, complement Budget 2025 by improving secure information sharing, supporting better care coordination, and helping to build a health system that is ready for future?
Je pense que
I think the Bill S5 will especially help us to not work in silos, to break down silos, and allow information to reach the right people to really provide the health care Canadians deserve. So I explained a little bit earlier when a colleague asked a question. This bill seeks to free data while protecting in personal information, but would allow information to be accessible to the healthcare system and the individual to benefit that person's health.
And my next question is, Canadian need a family physician. How is the federal government working with the provinces to help Canadian physicians trained abroad or in the U.S. return to practice and train in Canada? And how will this improve access to care for patients to help Canadians?
plusieurs façons. La première chose,
A
c'est
number of ways. The first thing is Canadians who studied abroad, they need their credentials. So we work with provinces, and the program is working very well. Increasingly, provinces are taking part in the program in order to have that international recognition. And the other thing I would say is that the Minister of Immigration has created a program for 5,000 places for healthcare professionals who come from abroad. There are many Canadians who were abroad who are returning to the country with this program because it's a fast-track program.
Thank you. Now my question is regarding personal support workers play a critical role in long-term care and community care. How does the tax credit fit into the government's broader health workforce strategy?
Je pense que ça a été une bonne
I think it was a good approach. It allows us to provide direct assistance. This tax credit allows us to provide direct assistance to people who provide support to the most vulnerable in our society. So this is money that goes directly into their pockets rather than going into structures. And I think for them, this is good news. When they file their taxes, they will see that $1,000 that the government gave them.
Thank you. Madam Chair, do I have
30
more time?
seconds. You have 30 seconds.
So, Minister, if you want to say anything, just last question. Is it safe consumption size saving life of Canadians?
C'est pour ça qu'ils ont été créés. C'est pour sauver
That's
des
why they were created, to save lives. They save people's lives who could die.
We started at 3:32, so there's an extra 2 minutes on the clock before the minister leaves. If the minister wanted to elaborate on that answer, she could. Because I don't know, you want to ask a question for 2 minutes? Well, no, you are not in the lineup, sir. We're going to go according to the lineup here.
Point
And
of
the
order.
lineup is that the minister leaves at 4:32, and then we go back into the list that I have in front of me
Point of order.
that you all submitted. Thank you.
Point of order.
Yes?
Would the minister be willing to stay so we can ask a complete round of questions?
That would mean the minister would have to stay for
I'm asking the minister.
5, 10. But I want to tell her what you're asking her to do, not just
That's not a
stay.
point of order.
She's got 10, she's got 20, will have 25 minutes to stay extra. That's what you're asking her to do. Now, point of order, somebody raised a point of order. Who did? Yes?
No, I
Doug?
just simply said this is not a change of order. This is not a point of order that the minister is here for a scheduled time and her time is up.
It's not a point of order, exactly. You're asking
Yeah,
the
it was
minister
his.
for a favor. So
Yes,
ask
that's
now,
exactly what I
but,
was asking.
You're asking her to stay an extra 25 minutes.
No.
That's
10.
what you're asking her
10,
to do.
10 minutes.
Another
Minister.
round is
Minister,
25
all I'm
minutes.
asking is for another 10 minutes, and the
Mr.
longer we
Major,
take this, the longer
Mr.
it takes.
Major, I'm quoting you. Can you stay for another round? A round is 25 minutes.
I asked 10. That was clarification. Anyways, Minister, can you or can you not stay?
I can't stay. No.
No, the minister cannot stay.
Okay,
Thank you. So we're going to suspend for the second hour.
Point of order.
Yep.
Can you just
Mr. Major, let me call the meeting to order first. Nobody's sitting down yet. We haven't got people sitting. Come on, for crying out loud, what's wrong with you guys today? Seriously. I don't know, it must be something. Okay, is everyone ready to sit down and start the meeting? It's begun again. What I would like to say before you call a point of order, Mr. Major, that the people here are the officials from Health Canada, plus one new official who is Dr. Natasha Crowfoot, who is the acting chief public health officer, for the information of the committee. Now, you have a point of order, Mr. Major?
Yes, and his question for the clerk, was Mr. Strauss on the list to speak on the speaking list?
Your staffer has been dealing with this. He is on the list.
He was, but
he has
you
now
stated
been
that he
moved.
wasn't. But just a clarification, he was on the list, right?
Yes,
the
he was
last
asked.
round?
Yes,
Okay.
but that is not a point of order, by the way. So I'm just giving you
Point of
leeway.
clarification.
Thank you.
Thank you.
So the meeting begins. Before we begin, I would like to let everyone know the reason that I gave you a shout out of a minute and 30 seconds is so that you can actually find a way to use your time as you can to shorten your questions so you can get the answers. If I allow everyone to go a minute, 30 seconds over time, it means that everyone in this room who are members do not get a chance to ask a question. That is the reason the chair allocates time. That's the reason committees allocate time. What we had in the last session were debates. We didn't have questions. We had debates which allowed everybody to go well over time and created a bit of a problem. So I am going to give you a 1-minute shout-out and a 30-second shout-out. And if Mr. Jonca does not want me to do that, he will have to be cut off when his time comes out. So I will not give you time allocations, but you are going to be cut off when your time is up. Thank you. So that's, as long as we are aware of what the rules are, I'm setting them out very clearly. So we now begin. We have the question and answer session starting with Mr. Major for 6 minutes, for 5 minutes, Mr. Major, because this is an actual continuation of the 2 hour.
Okay. Thank you, Chair. Thank you, officials, for coming here in the second hour. So, Ms. Weber, does Health Canada set an age requirement on who can access all federally approved supervised drug consumption sites? Yes or no?
Health Canada does the approval for the exemption request, which is an exemption from the CDSA, or the Drugs and Substances Act, and that allows for an individual to go into the site with possession of a substance and use it in a supervised location.
Is there an
Health
age
Canada
requirement on
does
that?
not set an age limit. Some of the sites may have policies
Yeah,
and
but not
procedures.
federal regulations. Like there's
Health
no
Canada
federal-
provides the exemption for to be allowed to have possession of the product in the site,
There's
but we
no-
do not determine an age.
The witness answer. It's not reasonable to ask a question or not let the person finish their sentence. It's quite rude, actually. So, Ms. Kendall, finish your sentence, please.
Health Canada does not have an age limit in legislation.
Thank you. If a 16-year-old enters the federally approved drug consumption site, is there any requirement from Health Canada that prohibits that minor from injecting fentanyl at that site? Yes or no?
If there's an individual who's seeking help from a supervised consumption site, there are health practitioners and individuals in that site that will support them and help prevent an overdose.
So if a 16-year-old comes in, there's no requirements around age? If a 16, 17-year-old comes in?
When an individual
Federally?
who's in need goes to a supervised consumption site to prevent an overdose, they are not asked their age.
So minors can consume hard drugs in a federally approved consumption site?
If there's an individual who's going to seek help, and the supervised consumption site also provides wraparound services, and it can be an entranceway into treatment, recovery, and also housing for that individual, regardless of the age.
What happens if someone shows up at a supervised site without ID? Are they allowed to come into the site?
The sites, if someone comes to the site and they're looking for help and support and they're looking for a place to be supported when they're using a substance, there's not a requirement for ID. If there's a policy and procedure by an individual site, I would not be aware of it, but there's nothing set in federal legislation.
See, we just heard that the minister's approving sites beside daycares, play schools, within steps of these sites. So someone can walk out of a school below age, obviously there's no age restriction, and go in and say, I need to have a fix here. So they're going to be in and supervised. There's no federal regulations on that.
So organizations determine the location of a supervised consumption site, and then they send in an exemption
What about
request.
the federal government on age?
And then the federal they come to the federal government to seek an exemption from the act. And that act allows an individual to be in that site to be supervised while using a substance to prevent an overdose. Thousands of overdoses have been prevented and lives saved at supervised consumption sites in Canada.
Ms. Weber, Health Canada gave the Parkdale Queens West Community Health Centre over $1 million through the Substance Use and Addictions Program to fund their services. The centre's own website lists, and I quote, harm reduction kits for booty bumping as one of their funded services. What does Health Canada understand booty bumping to involve?
So Health Canada does fund harm reduction, treatment, and prevention under the Substance Use and Addictions Program. There are different eligible expenses under the contribution agreements. We do fund some sites, and that is not their entire source of funding. And so
I was asking in particular, Ms. Weber, about booty bumping.
I'm not familiar with the eligible expense or even that activity in that site.
Okay, according to a foundation in San Francisco, and I quote, booty bumping involves mixing drugs, usually meth or cocaine, with water and squirting it into your butt through a syringe, end quote. Why is Health Canada funding an organization that enables drug use instead of preventing it?
So Parkdale is funded from a number of different sources, including the province. And so there are a variety of different healthcare services that are offered there. A supervised consumption site, not to be mixed up with the funding that's provided to organizations. A supervised consumption site is not funded by the Government of Canada. A supervised consumption site is an exemption provided by the Government of Canada for the possession of the substance.
I'm really
Health
glad.
Canada does not fund the actual supervised consumption.
That's my
Health
follow-up.
Canada
Thank you,
does
Ms. Weber.
fund-
You actually really does lead into the next one. So
Sorry, Dan, you've finished your time.
Okay.
I've let you go 10 seconds over. Thank
you for that, Chair.
I usually do that, Ms. Conant, to you as well. I let you have another 10 seconds or no. Okay, so everybody gets that ability to get that done. The next person is Mr. Ellison for 5 minutes, please.
All right. Thank you, Chair. Thank you all for coming. I'd like to follow up on Mr. Mazier's previous questions. First of all, I guess, Ms. Weber, just because you were being at these questions, from what I understand, many of the, and I have, like the health minister, I have toured Insight in Vancouver. I have actually toured a similar site like that in Calgary. Now, one of the questions that came up is, do they ask for ID? To the best of your knowledge, are there not large numbers of unhoused people who are addicted to substances who don't have ID?
Regardless of the ID, the sites are there to support individuals who are in need.
Exactly.
And so the sites, the individuals, as I've noted, have responded to over 65,000 overdoses, with over 624,000 referrals to health and social services, which can also be housing supports for individuals who are without housing.
Thank you. Thank you. Yes. And if there was such a policy that you can't access these services without ID, is it reasonable to assume that the patient will just simply say, well, then I'm not going to inject this. I'm just going to, or are they more likely, if turned away from the access to injecting in or consuming in this safe center, without that access, Are they not more likely to do this in an unsupervised place with a higher risk of dying?
Using substances alone or without not in a site will definitely increase the chance of overdose and death.
Mm-hmm.
Having been using the site is where there's someone that's there and the services are there to support.
Mm-hmm. All right, thank you. And in regards to some of the criticisms on location, is this not based on recommendations of the provincial and local authorities that they decide that this is required here?
So the sites are determined by the organizations, the communities. They come forward and they seek the exemption. In some cases, a province will write a letter to support the actual location or the site. In other cases, provinces actually have legislation to actually indicate the amount of distance between a school and a site. In Quebec, it is, I believe, 150 meters, and in Ontario, 200 meters. And so when a province does have a distance in legislation, the organizations in those provinces must respect that legislation.
Okay, thank you. So given that we've been reminded frequently that the administration of healthcare is purely a provincial jurisdiction, and that, in fact, from my previous tenure in Parliament, that attempts by the federal government to even so much as direct funding, we're told you can't do that because this is managed. Would you not say that all of these decisions, where they are, how they operate, whether or not they have ID, whether or not there's an age limit, that these would all be healthcare decisions under provincial jurisdiction?
There are some sites that are not provincially funded, which is, some of them are independently. There are a few that are privately funded. Those ones that are privately funded, if they're in a jurisdiction where there's provincial legislation that sets the distance, that's, as I've mentioned, in Ontario, they would have to respect the 200 meters set by the province of Ontario.
Okay.
In Quebec, they would definitely have to respect the 150 meters set by Quebec.
Yeah, my apologies. I guess I hadn't worded it clearly. I wasn't talking about funding. I was just thinking of the locations where they are and under whose jurisdiction the management of the healthcare is. And it is my understanding from talking to people.
43 seconds.
Thank you, Madam Chair. That the experts in drug addiction, they put these places where this is happening, do they not? They don't generally just say we're gonna put this in a place where no one is using drugs. Build it and they will come.
So the question is related to the legislation. So in the legislation, there's actually criteria that's set into the legislation, and one of the pieces of information that a site must submit is the local conditions indicating a need for the site. And so that is actually one of the legislated requirements when a site does come in to seek an exemption.
Thank you. And I believe that's my time.
Yes, it is. Thank you very much, Doug. I'm going to go to Mr. Blanchette-Jonca for 2.5 minutes, please.
Merci, Madame la Présidente.
Thank you, Madam Chair. A question for Ms. Curtis Mikalev. The Minister talked about saving lives with connected care. I'd like us to talk about something else that saves lives, vaccines. Let me remind you that Canada is the only G7 country that was unable to produce its own vaccine. I'd like to tell you, in the latest budget, Canada Strong, what are the amounts to improve and allow Canada to produce its own vaccine if, unfortunately, we have to face a new pandemic? I'll give the floor to my colleague. Now we are able to manufacture our own vaccine with the capacity in Quebec and in Ontario. So we already see there is the capacity to produce vaccines in Canada. What have you done differently between 2020 and 2026 to now be able to produce a vaccine if there were to be another pandemic? Okay, regarding what we've done over the past 6 years, there is this strategy for biomanufacturing.
a strategy. Donc,
En
il y a...
français, je n'entends pas la traduction, Madame la Présidente.
Oh, I'm listening for the interpretation, please.
Can we suspend? Yeah. Okay. What's happening? Let us find out what the problem is.
Ah, c'est juste si la témoin utilise un mot.
If the witness uses a word. How much was invested in the last budget to have a better supply chain to produce vaccines? In budget 2025, I don't have the exact numbers, except there were significant investments in the area of research involving our colleagues at the Institutes of Health Research. Okay, you can answer in writing. I think it's important to know. And the funds for clinical trials. So we know that that there needs to be quick information regarding pandemics. For C15, if there are major sanctions, major penalties that would intimidate a clinic from reporting, would this undermine public health?
Apologize, that was a bit quick for me in French. I'm sorry. Can I have it again in English? With the translation?
Madame la Présidente.
Madam Chair, it would be important to tell the witnesses that
Checking it.
30 minutes, okay.
No, I'm sorry. Last time we spoke, you had 59 seconds. I think you now have about 45 seconds, sir.
Ma question pour Monsieur Hébert.
My question for Mr. Ebad, have you assessed the cooling effect of C15 on international collaboration? Excuse me, Mr. Blanchette, I didn't understand the question. I want to ask the questions. Okay, I apologize. I understand, we're all tired. Could you repeat that, please? It's not the interpretation, Madam Chair.
Interpretation now?
J'ai pas.
Monsieur
C'est
Hébert,
le début de ta question, j'ai
It's the
manqué.
beginning of the question that I didn't hear, Mr. Blanchette-Jonca. Yes. Can we go ahead, Madam Chair?
It's still there.
Monsieur Hébert, est-ce que vous avez
Mr.
évalué?
Ebad, have you assessed in Bill C-15 that we're studying today the chilling effect of the system on international scientific collaboration?
Je m'excuse.
I apologize. Currently, we're studying Bill C-15. Oh, yes, I apologize. Now I've understood the question. You're talking about the $1.7 million in talent investment? No, not at all. Our federal investments continue to increase. We have a 2% decrease in the latest budget. Mr. Ebad, we're in Division 25 of the bill. Did you know that? That's today's study. Were you informed of that? Yes. But unfortunately, I'd have to return and submit an answer. I'd have to send you an answer because I didn't quite understand the question.
Hubert?
Rappel, question de privilège, Madame.
Point of privilege, Madam Chair. I regret to inform you that today I'm quite shocked. We're studying a bill, and witnesses confirm that they don't know we're studying this bill.
We talked about it.
Oui.
So I cannot answer for the witnesses, sir.
Je comprends,
You've made
Madame
your point, though, and it's clear. So the point is noted by everyone.
Madame la Présidente, vous trouvez ça
Madam
normal
Chair, do you find it acceptable that witnesses before committee don't know what topic we are conducting our study on?
The witnesses have heard you. They accept that they should have answers for this. If they don't, I cannot control that, sir. The point is made and the point is well noted. Thank you. And now I'm going to go to Mr. Bailey for 5 minutes, please.
Thank you, Chair. I'd like to go back to the sealed vaccine reports. I understand that it may take time to pull millions of pages together. Given the government's bungling of the vaccine injury support program that saw 2/3 of the $50 million go to consultants rather than injured Canadians, I think it's fair to approach the government with skepticism on this matter. My question is, what was the rescoping of this request, and when can the requesters expect to have their access to information answered? I would like a simple answer, 1 year, 2 years, please.
My understanding is 1 year.
Excellent. How many Canadians have reported vaccine injuries since the VISP began?
In terms of the VISP specifically,
Yes.
As of June 1st, which is what is in the public record, 3,317 claims have been
Excellent.
submitted.
Excellent. As of December the 1st, 2025, about $18 million has been paid out to claimants. How many claimants have received compensation of this $18 million?
Sorry, the 18 million is June the 1st, not December the 1st. There is new data for December the 1st. My understanding is that the third party provider will be releasing data shortly. And in fact, the amounts paid to claimants as of December the 1st are $21,474,722.
How many individuals are still waiting to receive their due compensation from the government?
So I will stick to December the 1st data. So for December the 1st, 2025 data, 3,557 claims received. Of those 557 claims, 2,061 are pending review.
Okay. Your website says 2,700 Canadians at some stage of the review process.
And so 2,061 claims pending review, reviewed by the Medical Review Board 1,433, rejected by the Medical Review Board 1,181.
Excellent. What is the average wait time that individuals are having to wait to have their claims processed?
It is a broad range depending on the complexity. My understanding, 12 to 24 months.
Okay.
But some of them are I understand some of them are for extended periods of time, which is
this has not
very
improved.
important.
This has not improved since Xero, the boondoggle, was exposed to the media, and your department took it back over. It's still taking that long.
Just to clarify, Madam Chair, thank you very much for this question because I think it's an important clarification. The Public Health Agency of Canada has not yet taken over administration of the program. That will take place on April the 1st.
April the 1st. So Xero is still running this program?
At this time, yes.
Oh, my goodness. I'm shocked. Okay, well, that is something. I'm going to switch over to this Connect Care, this S5 bill. Is this the same Connect Care that is been developed in the United States?
The legislation that was tabled yesterday is a facilitative piece of legislation. It is not the product.
It's not, okay.
It is not a product.
Okay.
It is a framework which allows the development of regulations and consultations with provinces and territories and standards agencies.
Excellent. One of my concerns about this is the burden it places on physicians. And currently we have such a shortage of physicians, and Alberta has just gone through this MR repurposing process where they spent over $1 billion on it. And I really hope that this government takes the time to learn some of the struggles that Alberta went through implementing this over the last 15 years, because this system of connecting
45
individuals
seconds?
does not happen overnight. It is a very long process. And one of the things that they learned in Alberta is a lot of the hospitals didn't have the internet service for it to even work. So I bring that to your attention, and I'll look forward to learning more about it. One last question. I understand you said 5,000 spots were going to be made available for international medical graduates. Is that correct? Just a straight yes or no? 5,000 more spots.
Thank you for the question. I don't know the 5,000 spots you're talking about.
Okay.
I think we did talk about Budget 2024 funding from Health Canada, which is supporting 120 new training spots.
120 new training spots.
Yes.
All right. Thank you, Chair.
Thank you. You've got... Well, that's it. Sorry.
Yes, thank you.
You've just gone 10 seconds
perfect.
over. There you go. Very well done, Mr. Bailey. Now, Ms. Just.
Thank you, Madam Chair. Thank you to all the officials here today. I would like to ask a few questions about Bill C-15, which, as my colleague has pointed out, was what we were going to be considering today. First of all, I'd like to understand what actually motivated the need to amend the Human Pathogens and Toxins Act in the first place. I know you're addressing biosecurity issues, but could one of you, whoever is the most appropriate, elaborate on the motivation to make this change?
Certainly. Thank you very much for the question. There's a number of factors that have contributed to the need for the amendments to the Human Pathogens and Toxins Act, not the least of which has been significant investments in the biomanufacturing and life sciences strategy from the federal government, which has led to a significant increase in the number of facilities that are seeking to work with higher risk pathogens and toxins. The other piece that's really contributed to it is an evolving threat landscape. There's been awareness of state actors, non-state actors that are interested in exploiting Canada's open science approach and our extremely very good research in science and biotechnology and biomanufacturing. And so awareness of that increased threat has led to some requirements to amend the legislation. Thank you.
So would the situation that we heard about from one of the labs, I believe it was Saskatchewan, during COVID-19, that there was some questioning about some individuals, I believe researchers from China that had been investigated, was that part of kind of a suspicion or leading to these amendments?
So there are a number of factors that contributed. Certainly we've taken into account experience in Canada with respect to some of the situations that you're referring to. We've also commissioned some reports. So for instance, we've worked with the Communications Security Establishment, who had identified through a threat assessment that some of Canada's high containment facilities were very likely to be targets for espionage from foreign state actors, and then also experience in other jurisdictions as well. For example, in 2022, there was a report that was published from some American scientists that documented their ability to hack into the heating, ventilation, and air conditioning system for a lab to reverse the airflow, which would create significant safety issues for workers within that lab. So there's a variety of different scenarios that all contributed to some of the proposed amendments that we've put forward.
I see. So it sounds like the threat was considered considerable and obviously very important to put these amendments forward as you have. Now, as I understand it, there has been an advisory committee established by the Public Health Agency of Canada back in 2015, and to give the kind of advice that you're talking about. So could you maybe just talk about the role of the advisory committee, how that works, how often they meet, how the Public Health Agency receives the information, etc.?
Certainly, yeah.
You have 30 seconds to do that.
Okay, thank you. I tend to speak quickly. The advisory committee meets in person once per year, and we often have an ad hoc meeting a second time per year that occurs virtually. They tend to provide advice more on pathogen risk assessments. So we have pathogens that are broken out by risk group, and so they tend to provide more information related to biocontainment and biosafety. We are increasing the biosecurity expertise, however, on that panel as well, so that they're better able to provide us with some advice there. And then as it relates to other biosecurity expertise, we often ask for other input from other parts of the federal government as well. But they are there as a resource, and we use them frequently as we look at things like changes to our incident reporting, anything that we're looking at in terms of changing pathogen status. Thank you.
And
Thank you.
Is that my time?
You got 36 seconds.
Well, just a little bit. I understand that you've added some particular definitions. So a definition of what sensitive information means. Maybe just very quickly, just tell us what you've been doing there.
So the specific definition for sensitive information will probably be finalized when we go through regulatory consultations, but certainly as an example, the location of high-risk pathogens within a facility and the type of high-risk pathogens within a facility would both be examples that we would consider sensitive information.
Thank you. Thank you very much. Excellent. Bang on.
Thank you.
Bang on time. Extremely well done. Both you and Miss Barton. Okay, shall I now go to Ms. Conans for 5 minutes, please?
Thank you, Chair. I'm just following up on my question to the Minister. If I could ask a question to Ms. Weber. So what I asked her was when you came to Health Committee, you had said that you had confirmed that Health Canada funds are used to purchase crack pipes. But when we asked the minister on December 11th, she said that the government does not fund crack pipes. Who is telling the truth here? And you can't both be right. You can't both be wrong here. Who's right in this?
Thanks for the question. So it's an important point to clarify. Health Canada doesn't purchase harm reduction tools under our substance use and addictions program. What Health Canada does do is provide transfer funding to community groups, municipalities, other levels of organization, and Indigenous communities. So I think...
So you're saying that, excuse me, but you're saying that crack pipes are considered harm reduction, and you supply the funds, the government supplies the funds, but they don't follow up with what is exactly being bought. It's crack pipes have been bought. For example, SUAP gave $190,000 to a meth pipe pilot project in Manitoba. And why would the minister not know that?
So I think just the point that I made, that there's a clarification. Health Canada doesn't purchase them under the program, so there's that understanding. What Health Canada does do is transfer funding to communities. So what communities in crisis may do under our emergency treatment fund or substance use and addictions program, recognizing what they're seeing in their community, they come forward with a proposal.
So when communities say they need
harm
crack
reduction,
pipes,
it includes safe inhalation kits to minimize the risk of infectious disease.
Okay.
And HIV.
Yeah, so crack pipes are considered harm reduction in communities. Okay, that's...
Safe inhalation kits are used to prevent the transmission of infectious disease such as HIV, Hep C.
Okay, thank you. Safe inhalation or crack pipes, okay. So, my next question is for Ms. Weber again, thank you. Now that the government's decriminalization program with British Columbia has finally ended, a disaster, as many will say, will Health Canada be reporting on any of the results of the effects of decriminalization on addiction and overdose rates in British Columbia?
Sorry, if you could repeat the question. I thought you were asking if they were going to evaluate the actual exemption, but I think you were asking...
Yeah, now that the pilot program has ended, will Health Canada be reporting on any of the results of the effects of decriminalization on addiction? We saw 6,000 overdose deaths in British Columbia Just wondering what the follow-up is going to be quickly.
Yep, so there's two elements to this. The Public Health Agency does have surveillance of overdose deaths, and they report on a quarterly basis, a report. However, in addition, I would say, for the DCRIM, we actually are receiving a final report from British Columbia that we will be able to
On whether it was
evaluate
successful
And
or not.
there is an independent research happening by the Canadian Research Initiative on Substance Matters, CRISM.
Is there a deadline on that report? Is there a deadline for that report?
Yes, there is. It's a 5-year arm's length evaluation of the exemption and its implementation.
So in the next 5 years, it'll take 5 years. So in the next 5
They
years,
started it at the
we
beginning.
won't
Sorry to
know.
interrupt.
We won't know for 5 years the devastation that it's caused. So in other words, there could be another pilot program starting again. Why not? If it was something that even David Eby, the premier, said a year ago that it wasn't working, and yet it continued and continued. So is there will Health Canada, upon completing this report, present it to this committee?
So the arm's length evaluation, it did not start today. It started midpoint or earlier in the actual exemption. So once it completes its full 5-year review of looking at the data during the exemption and then following the exemption, it will deliver a report, and that could be shared. That will
It
be
needs
shared.
to be shared, I believe, with this committee.
And yes, and then what's also important is the province of British Columbia posts on their website quarterly reports that they send to us, to Health Canada, and those are available today.
Okay, 6,000 people, over 6,000 people died. I think we need to accelerate that report.
Thank you, Ms.
So that it doesn't happen again.
Thank you. Ms. Chi for the Liberals for 5 minutes, please.
Thank you, Chair. My question is to officials at CIHR. We know that CIHR has invested heavily in digital health and data innovation. Want you to sort of speak to how the bill, the Connected Care Bill, will help turn that research into really great tools using clinics, hospitals, and communities across Canada.
Madam Chair, thank you for the question. Member Chi. I would say that you've already heard my colleagues speak to what it means for our doctors in our country. It is one of the tools that we hope will facilitate the care we give. I live this every day as a practicing physician when I'm out there. The fact that we're still sending faxes to one another is not a great idea. What we want to do, all of us, I think, is to that interoperability bill to start connecting the dots an awful lot more. We want to have a pipeline of information that we collect once, collect well, use responsibly, and effectively make every possible use we possibly can. The bill is really, the simple way to think of it is it's to change from an attitude of data hoarding to one of a public trust and public good. We want our data to be useful every chance we get. In research, what it means for us is largely that we essentially use it to do clinical trials better and release that. It also means that we can connect up, we were talking just before, connecting up our early term screening, and we start thinking about using the data from all the way from preconception to death in a way that we can not only help our patients but transform our economy. One can easily think of generating tools and approaches, predictive algorithms, and that's what our research is about, to be useful in a way to change our medicine of the future.
Thank you. And you alluded to the fact that the bill really creates that foundation for...
It's one of the pieces, yes.
Yeah, great data, trustworthy data, and with that foundation supporting, responsible AI in healthcare as well. And, in your opinion, what are some of the promising areas of research CIHR is already seeing, whether in early diagnosis, personalized treatment, or system planning?
I was talking to someone the other day, and the term used was we do soup to nuts. So we do research on almost our 18,000 scientists we just funded. Effectively, you can imagine, would do almost anything in your sphere of interest. But in this particular realm, and to be honest, data is everything we do. Science is about generating data, whether it's clinical science to improve the care we give, or whether it's to basically image better and everything. I'll give you one example. unfortunately not Canadian, but this is where we want to be. This past week in the Lancet, we had a publication, our Swedish colleagues published a trial in a public health domain where they randomly allocated one group versus another and compared the use of AI-supported evaluations of breast screening versus standard of care, which is 2 doctors. And in that, the AI-supported evaluation came out ahead. It decreased workload by doctors by 44%. It decreased the rates, found more cancers early on, interval screening between 2 points in time, and found cancers earlier and were more treatable. We want to be able to do those kinds of studies in Canada, and right now we're still at a point where we are wishing we could.
Thank you. And you spoke earlier a little bit about creating creating jobs, generating, stimulating economy. So how, with this bill and with our investment in science and research, how do you see the Canada's life science sector grow and create those high quality jobs?
Well, in my view, I do life sciences research, so thank you. I would support all research.
43 seconds?
Pardon me? Oh,
43.
In my view, the idea here is that everything we do in this sector will make a huge difference to Canadians in every way. And in 15 seconds, I can't do much better than that.
You've still got 27 left.
You've got time.
Oh, 27.
27 seconds.
I would say that we need to put a lot of pieces together. And the first big piece is to function like an all-of-Canada approach, an all-of-government approach. In our government currently today, all of us have things we want done with data. And the big thing we have to do is start working together to bring it together. So as we think through of data infrastructure, data governance, we have organizations to do that. Our compute and AI strategies and our programs have to collectively work together to generate what I just said.
Thank you very much.
Thank you.
Blanchette-Jonca for
Mr. Blanchette-Jonca, 2.5 minutes. Thank you, Madam Chair. My question for the Deputy Minister was about clauses 400 to 456 of Division 25 of Bill C-15. Is there a specific impact assessment on universities, public institutions, on which clause? 400.85. So, Deputy Minister, we are studying clauses 400 to 456 of Bill C-15. I haven't memorized the content by clause. So it's the clause on investments. Is there an assessment, a specific impact assessment on universities, hospitals? There's not an evaluation. I'll let my colleague answer. Thank you for the question.
25, the amendments to the Human Pathogens and Toxins Act.
Okay.
Certainly, we have been conducting some consultations on the Consulting with Canadians site. Part of the consultation has informed the approaches that we put in the amendments. And what we are trying to do is target a risk-based approach where the most stringent requirements will be on the facilities that are working with the highest risk products.
Donc là, vous modifiez en profondeur la loi sur les agents
So
pathogènes
you're
humains.
overhauling the Human Pathogens and Toxins Act, but you don't have an impact assessment.
No, not currently on the facilities themselves. Many of the provisions that will have an impact on these facilities will actually come through regulations. And so as part of the regulatory consultations, we'll be conducting a cost-benefit analysis and further consultations with the facilities themselves.
D'accord. Monsieur Higgs, est-ce que vous avez chiffré?
Okay, Mr. Higgs, have you given a number to these costs for clauses 400 to 456?
I would not have that information with me right now.
Okay. Donc, j'en comprends bien, Madame la sous-ministre.
So, Deputy Minister, we are studying a bill. We don't have an impact assessment. We don't know how much it will cost, and you want us to adopt this as legislators. I'll let my colleague speak. She doesn't reassure me. We don't have an assessment of the costs. The fact that we don't have an impact assessment that will come once we've put it in place. Both. You want to change the act, but you don't know what the consequences are. You don't know how much it will cost. No, I wouldn't say we don't know the consequences. I think the question is, have we already done an assessment? But the act hasn't been put in place, so we haven't done the work of implementation. So there wouldn't be an assessment on the effects.
And 19 seconds over. I'm going to go to Mr. Strauss for 5 minutes, please.
Thank you, Chair. I have some kind of big picture questions for you. It's our understanding from news reports over the last 20 years that there's increasing overdose deaths in Canada, and this is due to what is called a toxic drug problem or crisis. Where do the toxic drugs come from generally?
So there's different sources. They can be domestically produced.
Mm-hmm.
They can also come across borders illegally.
Mm-hmm. But where, like, which country in general do the precursors and the finished products come from in Canada over the last 20 years?
I'd say largely right now domestically produced.
Are they domestically produced from precursors also produced in Canada, or do the precursors come from elsewhere?
Largely domestically produced. There are some illicit precursors that could cross the border, that would cross the border.
From where? Like, if the illicit precursors are coming here?
We would see them coming from Asia. We would see
Any
them.
specific countries in Asia that they come from? Do they come from Japan or Taiwan?
We have seen precursors come from China.
Okay, thank you. What is your understanding of what the rate of overdose deaths in Canada has done over the last 10 years?
The volume, the numbers?
The rate, the per capita death rate from opioid toxicity.
I'll just turn over to my colleagues. The Public Health Agency tracks the surveillance of the drugs.
Please.
The overdose crisis.
So total deaths since January 2016 to June 2025 would be 53,300.
But how has the yearly rate changed over that period?
Right now we're seeing, I would say since 2020,
no, I'm asking over 10 years.
Over the past 10 years, it has been up and down. So, but I would say over the past year, we're seeing a significant.
It's been markedly
decline.
up and then slightly down.
Yeah.
So it tripled, and now we're at about 2.5 from the rate back then. I'm wondering, Ms. Weber, if so my understanding is you have carriage at Health Canada over illicit substances. Which countries in the developed world have the lowest rates of overdose death? Like, let's say in the OECD.
That's a good question. I don't have that. I'll have to come back with a written answer.
I can let you know. It's Turkey, Israel, and Japan.
Thank you.
Do Turkey, Israel, and Japan have supervised consumption sites?
That's a good question.
They do not. When did supervised consumption sites start being introduced en masse in Canada?
We have seen the increase over the past 15 years.
You were going to say 10, but it is 10.
I think it's also important to understand that the drugs that are being used globally are different. North America is experiencing a very different drug crisis than is experienced in Europe or Eastern Europe. The fentanyl crisis that North America is facing is one that is quite unique, and the types of drugs that are being used here in North America are different than what we're seeing in Europe.
So why is it unique? Because Turkey, Israel, and Japan are much closer to China than Canada.
Well, your first question that you said it goes back to the sources. And one of the concerns that we've seen in this space in the 2000s and the 2010s was overprescribing. And we also saw a concern with pain medication. And so that continues to be a concern. And in Canada and North America, we have seen prescribing of opioids. And there's been an evolution in the type of opioids. And then as prescribing practices evolved in the 2010s, then we did see individuals move to fentanyl. And they found the source of fentanyl as illicit fentanyl.
Yeah, I'm sensitive that it is multifactorial. But I guess one of the factors is your department adopted supervised consumption sites as a way of addressing this. But we're seeing the rates get worse. I guess I'm wondering, what would it take to acknowledge that this has not been a terrific use of resources? Like this has not changed the game here.
So the earliest supervised consumption sites go back to actually transmission of HIV, and infectious disease. And then we did see in recent years, and we've talked about the overdose rates, we have seen supervised consumption sites where communities come forward and request an exemption because that's what they see is helpful for their communities. You noted the question about resources. Health Canada does not fund the supervised consumption sites. We provide an exemption from the Act to enable the possession of the substance so that individuals can go into the site and have oversight of the use of the substance.
May I interrupt you for just 1 second?
Thank you.
For sure.
Over.
Oh, thank you.
Thank you. I now go to Ms. Sidhu for 5 minutes, please. Sonia.
Thank you, Madam Chair. My question is to the Health Canada. Yesterday was the World Cancer Day, and Canada has continued to approve new cancer treatments, including therapies for early stage breast cancer and the other cancer. Can you tell us how Health Canada's approval of innovative cancer drugs, including treatments from company that is improving outcomes or expanding options for patients or the early detection? What is out there? If you can elaborate.
Thank you for the question. I will just refer to a program that we have called Project Orbis, where we work with other regulators who approve these products to expedite the number of products that come to Canada specifically for cancer treatments. And so over the last year, for example, 2025, 16 of these products have been approved, and over the last 6 years, 94 of those products. And so these are all oncology products available that have been approved for the Canadian market and eventually available to Canadians.
Thank you. My next questions, I know my colleague talked about Bill C-15. I'm about to talk about Division 25 replaces existing schedules with the Publicity Accessible Registry. How does this registry improve transparency and allow Canada to respond more quickly to emerging biosecurity risks?
Thank you very much for the question. Currently, when we wish to make any changes to the status of various pathogens or toxins, it actually requires a full regulatory process to go through. There's about 6,000 pathogens that have been assessed by the Public Health Agency, and about 2,000 of those are currently regulated by us. So having a registry that is an evergreen list enables us to make much more rapid changes to the potential status of a pathogen in response to evolving scientific evidence, and or potentially to make changes to the nomenclature of the pathogens, so the names of them, as they evolve through science. So it's a much more rapid and effective process for us to make those changes. And then the registry is, we currently have an e-pathogen that is not the formal registry, but it is publicly accessible, and so any of those changes moving forward as well, that becomes the official registry. So it will be open and transparent to researchers as well as to the Canadian public, and they'll have real-time insight into the risk groups for the various pathogens and if there are any changes. Thank you.
Budget 2025 continues to invest in life sciences and biomanufacturing. How do clear and modern oversight rules help researchers plan long-term and high impact or result-driven projects?
I think that we have had two spectacular years of investment in research, budget 2024 and 2025. And those investments will allow us to increase our rates of discovery in all forms of our science. I would say that we're investing in the infrastructure programs around that. That's through the Canadian Foundation for Innovation. This last budget had $400 million. We are investing in talent, $1.7 billion, related to attracting the talent and the best and the brightest to join what I consider to be best scientists in the world here in Canada. And we continue to increase our core budgets. The government's been very generous in that regard, and we continue to, because of budget 2024 increases, we'll continue to do that. So those investments, both in infrastructure, in programs, and in all kinds of other strategies around biosecurity and everything else, will have help us have a secure environment for science in Canada.
You got 30 seconds, Ms. Sidhu.
You just last question: how we can secure public trust in essential, especially to health research?
How can we increase public trust? Was that the question, Madam Chair?
Yes, when we are supporting students, trainees, or early career researchers.
Well, I think you're answering the question for me in a sense that what we have to do and continue to do and believe in science and evidence-informed public policy, which we support. I think there are organizations like many organizations where we engage our students, Save Our Science and others. I'm trying to remember the name of the organization, which goes out into high schools. It's not just a matter of our agency, it's a matter of getting them young and really training them up. What was the name of the?
Thank you.
Yeah, that's it.
Yeah, that's
so
it.
a lot of that. So we're investing in that as well. So
Thanks,
thank you.
Dr. Yuva. Thanks, Ms. Sidhu. I just wanted to ask one question, and that is, can you tell me how many overdose deaths have there been at safe injection sites? I was the one who started the first injection site in Vancouver when I was minister, based on work that we had seen in Europe. And it was a 2-year pilot project. Since then, how many overdose deaths have you seen at safe injection sites?
To my knowledge, none. Zero, unless there is a reporting that I am not aware of in recent time. But my understanding is none.
So safe injection sites save lives.
They save hundreds of thousands of lives.
Thank you. Thank you very much. Now, we have another 3 minutes, and I have some homework to do. So before we go there, I would like to thank all of the witnesses for coming and giving us your insights and your valuable information. So thank you very much. And then as you leave, I will put forward a couple of housekeeping things to the committee. First, the clerk circulated today a budget of $500 for the next meeting on the National Emergency Strategic Stockpile. Everybody's cool with that? Yep. Yeah, there's nobody saying no? Okay, and I want you to also know that the deadline for the public to submit briefs for the study of antimicrobial resistance on Monday is on Monday, March 3rd. So just giving you the deadlines, guys. All right, and so, yes, somebody put their hand up? Mr. Blanchet-Jonca.
Yes? Thank you, Madam Chair. The date you're putting forward, March 3rd, is that correct? The date that you mentioned, is it correct that it's March 3rd?
Oui.
Yeah.
Qui a décidé ça?
Who decided that?
Actually, it is the pleasure of the committee to decide if you agree with it, but it will give the clerk adequate time to call witnesses. That's why. Yeah.
Ma question est qui a suggéré la date
My
du 3
question
mars?
is, who suggested the date of March 3rd?
The timelines needed to call people and get people to come. Otherwise, we can have a meeting with one witness. That's it. Anything else?
15?
So I now...
Oui. Madame la Présidente, je veux simplement
Madam Chair, I'd like to suggest March 15th.
You would like to see it moved to March 15th? Is that what you're suggesting? Will that give us enough?
It's just for the brief. Whenever the committee decide, we can put it.
Okay. If everybody, does everybody agree with March 15th? Okay. Okay. Well, it's March 15th. So be it. All right. That's good.
Merci.
Now I adjourn this meeting.
Thank you.
Thank you.